are able to join us remotely, and to those who are going to be viewing the recording of this session. My name is Allison Moose, and I'm the Knowledge Translation Specialist for the Methods Clusters here at the BC Support Unit. And with me is Zara. Zara, would you like to introduce yourself?
Hey everyone, good afternoon. Thanks for joining us today. My name is Zara. I'm the Administrative Assistant here at the unit.
Okay, and Zara works primarily with the methods clusters as well. So if you have questions not only about the DASHI, the Data Science and Health Informatics methods cluster, but any of the others, please feel free to contact us, and my contact details are at the end of the slideshow. So without further ado, I would like to turn the meeting over to the lead of the Data Science and Health Informatics Methods Cluster, Dr. Leanne Currie. And we're going to put up the PowerPoint presentation. And if you would like, after the presentation, after the webinar, to have a PDF of the slides, please feel free to contact me and I'll send you a PDF of the slides. So over to you, Leanne.
Hi, everybody. I'm Leanne Currie, and I am a faculty at UBC School of Nursing. I'm also an informatics researcher and have done some data science activities throughout my career, and was very happy to be appointed as the data science and health informatics lead to the BC Support Unit. Today I'm going to be presenting on a visioning workshop that we held on October 16th, so just over a month ago. The rest of the team include Dr. Kim McGrail, who is faculty in the School of Population and Public Health and the lead for PopData BC, and who's also the data lead, so kind of figuring out infrastructure and other big ops for the BC Support Unit. So she's functioning as an advisor with the DASHI Methods Cluster. You've already met Allison, who is our Chief Project Manager and Making Stuff Happen person in collaboration with the rest of the team. So the purpose of this webinar is to share with you highlights of what was discussed at the visioning workshop on October 16th. To invite your input as we're proceeding to move forward with this methods cluster idea, and also to give you some information about the next steps for this cluster. The way I think we can work this is, if there are questions, if you could raise your hand using the icon in the WebEx during the presentation, but there'll be lots of time for questions at the end and a discussion about some of the nuances in detail if there are more questions. So our workshop, as I mentioned, was held on October 16th. The objectives of the workshop were to establish a foundation about data science and health informatics within the context of patient-oriented research. Also, we wanted to initiate a discussion regarding a shared vision for British Columbia for developing and testing new methodologies that would be relevant in BC as well as elsewhere in the country and possibly the world. And then also to locally develop a community of methodologists and relevant stakeholders in this scope. During the workshop, we had an introductions activity. We had some slides that focused on establishing a shared understanding. Sorry, my phone is ringing. I'm going to ignore it. We had some keynotes and a series of activities that I'll describe today. So we had broadly recruited individuals We had an open call for expressions of interest. We asked people to complete a survey that gave us some information about perceptions of activities related to data science and health informatics in British Columbia. We then snowballed based on consulting lots of individuals. We ended up with a total of 36 people who attended the conference. You can see the photo at the bottom of those in attendance. They were people from all stakeholder and methodology aspects. So we had patient partners, researchers, healthcare providers, and decision makers. We had representatives from Northern Interior Island and the Lower Mainland. We had representation from the First Nations Health Authority, Island Health Authority, Interior Health Authority, Vancouver Coastal Health Authority, Providence Healthcare, BC Cancer, and then we had people from UBC, SFU, UVic, and I think there was one other research or organization I can't think right now, but then we had members of the Ministry of Health attend and members of the support unit. So our goal was to establish a shared understanding, and I'm going to pass the mic to Allison, who will give us an overview of the goals and activities of the BC support unit in regards to the methods clusters.
Thank you, Leanne. So one of the things that people told us in the survey before the visioning workshop was that they wanted to make sure that we defined what we meant by patient-oriented research, and that they have a better understanding of what the support unit is and what the methods clusters do within the support unit. So in Cole's Notes version, here we go. So as far as patient-oriented research, there's 4 criteria that the BC support unit uses to define patient-oriented research. It encompasses the continuum of research, right from identifying the question to designing the study, to undertaking the study and analyzing the study, with patients engaged as partners throughout the entire part of the continuum as far as what's appropriate for that given study. It focuses on patient-identified priorities. It's conducted by multidisciplinary teams in partnership with relevant stakeholders, and it aims to apply the knowledge generated to improve healthcare systems and practices. Overall, the goal is for research that's co-developed and co-used. So that you will see many different definitions of patient-oriented research in the literature, and this is how we define it within the support unit. Ideally, we'd like all 4 criteria to be met. However, that's not always possible or relevant. It's important to distinguish between what SPORE is and what the support unit is. SPORE is a federal, provincial, and territorial coalition that aims for healthcare research to be integrated into care. There's actually 5 elements of SPORE, of which the support units are only one. There's 10 support units across the country, and you'll see that support is in all caps, and that's an acronym for Support for People and Patient-Oriented Research and Trials. The BC support unit has 3 goals. First of all, to build capacity to conduct and implement high-quality patient-oriented research in all regions of BC, to increase the quality and the impact of that research, and to ensure ongoing support for that research. We have 2 sides to the support unit. The first side is service delivery. So when individual teams are looking for support for their research, for patient-oriented research, we have a distributed model to provide research teams with that support. So we have 5 centers. The Vancouver Centre also functions as a hub, but we have centers in Fraser, Island, Interior, and Northern. Then the second side of the support about the methods clusters, but we have 6. You see that we have knowledge translation and implementation science, which is led by Linda Lee, data science and health informatics with Leanne Currie, real-world clinical trials with Dr. Hubert Wong, patient engagement with Erin Mahalik, and health economics and simulation modeling with Dr. Nick Spanbeck and David Whitehurst as co-leads. We recently had a call for a lead for patient-centered measurements, and that's currently being determined. So if you look at it, then there's really 2 aspects to patient-oriented research. There's doing patient-oriented research, and there's studying patient. So
yeah, I think we're going to need to mute the people who, Sarah, can you mute the participants?
yeah.
Or for the person who's not on mute, please mute.
Got it. Thank you, Leanne. So there's, as far as the studying side, I'm not sure why that's frozen. Okay, as far as the studying side of the support unit, that's the focus of the methods clusters. So if you were doing patient-oriented research, that's when you would go to the regional centers. You'd come to the inquiry form on our website to fill out what kinds of supports you need. The studying side is the focus of the methods cluster, and in this case, data science and health informatics. We have a number of partners who help us to deliver these services, and as you can see, there's a vast array of partners, not only geographically distributed, but also their specific areas of focus and support. So collectively then, in the middle, we have our regional centers in the hub helping with the service delivery. The yellow zone depicts our methods clusters. And obviously, the results from studying the science of patient-oriented research can be integrated into the delivery of support for those services. So the work of the studying and the doing side of the methods of the support unit go very much hand in hand. And that's provided within the context of our funding and our partner organizations. And then there's some networks which have been funded by CIHR, and there's 2 demonstration projects that are intersect with the BC support unit. So this is just a very basic graphic representation of the structure of the support unit. And then finally, as far as the methods clusters are really the science pillar, and their mandate is to advance the evidence base for the scientific methods used in patient-oriented research by fostering a community of methodologists with relevant stakeholders to engage in discussions and collaboratively undertake projects that advance the science. So there's really those, what you see on the right-hand side of this diagram, is there's 3 goals: to advance the science by undertaking projects and methods, to promote the use of the knowledge that's generated from those projects, and then to promote the field of research itself. So as far as the methods clusters providing support, no, if you need support for your individual project, then please click on the green button, Inquire About Our Services, from our webpage. Because that will give you an inquiry form that you can then be connected with the supports you need. Okay, so the impetus of the methods clusters is to undertake the project. The service delivery side of the support unit is to help you to do your project. So now back to Leanne for giving some more detail of what we covered at the visioning workshop.
Is going to unmute me.
You're good to go, Leanne. We can hear you.
Great, excellent. Thank you. Thank you, Allison. I've just got a very brief overview. We did have some preparation materials that people were able to look at, but in general, the field of data science is an area of research where we're trying to extract insights and information from data. It's really the intersection of multiple different disciplines, including statistics, mathematics, software engineering and programming, including database design and architecture, problem solving. The goals are to capture data in ingenious ways, and it involves cleansing, preparing, and aligning the data. The big thing about data science is that it deals with both structured and unstructured data. I'll talk a little bit more about that in a couple more slides. The relationship between data science and the field of health informatics is that there's some overlapping areas, and the field of health informatics is also known as e-health, digital health, biomedical informatics. There's probably some other new terms that will be coming out. But in general, it's the use of information and communication technologies in healthcare. Like data science, it is at the intersection of computer science, but it also typically involves the idea of library science, so architecture for information resources we might be seeking in healthcare, cognitive science, so understanding how humans think about things, and then organizational science, so how are we actually using technology in the enterprise healthcare system. And then, of course, the whatever domain science in the healthcare endeavor that might be the particular topic area. It could be broad as health science, but it also could be more narrow, focusing on specific things to the physician's work or to nurses' work or to pharmacists' work, etc. So some of the methodologies that are in both of these domains, I'm not going to read these all, but I'd like just to highlight that in the data science column to the left, lots of activities such as machine learning, which is where we use a computer to help filter through large data sets in order to look for different patterns. We can also apply new methods of mathematical modeling or statistics. We can look at including temporal modeling, so mapping things over time. Algorithms for linking data from disparate databases, information visualization and visual analytics. I mentioned information architecture, natural language processing. So this is the idea of unstructured data being sorted and patterns and relationships between words being analyzed. In health informatics sphere, we're looking at system design so that we can ensure data reuse and information exchange, including personal health records and other types of electronic health records. We have big efforts put forward on privacy and security. Data mining is an overlapping area with data science. Designed to ensure access to hard-to-reach citizens, so bridging the digital divide. Health informatics also includes user interface design methodologies, and multiple opportunities to apply data science methodologies at the point of care in any healthcare transactions. So some of the examples that are the type of work that we will be hoping to do within the scope of the DASHE methods cluster are taking data science methods to improve healthcare processes and patient-reported outcomes. Data and science and health informatics methods to improve processes such as real-time predictive analytics. So that's taking some of the front-end stuff that we do in health informatics, applying it to perhaps mathematical or statistical models, maybe with some machine learning, all sorts of different opportunities there. And then computational methods that address limitations imposed by, for example, data sharing constraints. Outside of the scope are administrative processes. So, for example, something that helps us do contracts is not going to be in scope. anything that's related to regulatory requirements isn't in scope of the projects. We might help inform some of these things, for example, privacy and sharing, but we're not going to be changing policy per se. Other things that are outside of scope would be scientific review, ethics applications, different things that might be relevant to a project, but not necessarily, that's not a methodology we're going to be tackling inside of our methods activities. During the workshop day, we had 2 keynotes. Raymond Ng, who is the director for the Data Science Institute. He's a professor at University of British Columbia in computer science, and he's the Chief Informatics Officer for the Proof Center of Excellence. He provided a keynote on big data for personalized medicine. The second keynote we had was from Douglas Kingsford, who's Chief Medical Informatics Officer at Interior Health Authority. He's also on a number of different committees at the provincial level, including the Information Management, Information Technology Steering Committee, and the list of acronyms there are his other activities. And he's also very actively involved in many initiatives through Canada Health Infoway. Douglas is a physician, and he also has a PhD in artificial intelligence. His presentation talked about emerging information management, information technology context for clinical analytics in British Columbia. So he gave us some ideas about what's happening in the local context. On the left is a summary of the presentation by Professor Ng, and as I mentioned, it was big data for personalized medicine. He provided a number of different examples that talked about how we can use many different analytics for looking at patterns. He described the Proof Center and their work towards genomic identification. He just at the bottom, you can see some key research opportunities in biomarker discovery. He suggests that data quality cleansing and pre-processing are important activities as a methodology. Information extraction as a goal of these methodologies in data science, and then integrating different types of omics data. So looking at multiple different data sources. The presentation by Dr. Kingsford is presented on the right-hand side of this snapshot, and we do have larger versions of these images that were created by our visual facilitator during the presentations and during the workshop day. The presentation by Dr. Kingsford talked about the operational context, the idea for federated networks. So rather than the province having one giant big database where all health data are aggregated, we would need a network of databases that had some data stored in each of these things, but relevant linkages built between the different entities. He suggested some short-term goals, and I cannot read them from my screen here. Give me a second. Including two-way electronic communication across circles of care, complementary to existing healthcare systems and projects, a transitional and use of portals, transactional use of portals, human readable data, initial use cases to support primary care networks, and making sure that we address privacy barriers. A lot of work is going on that at the ministry level right now. Next slide. So during our presentation, we had the results of our surveys presented. The respondents to the survey were 21 methodologists, including computer scientists, information architects, visual analytics researchers, image analysis researchers, and informaticians. We had 5 policy or decision makers provide feedback. We had 6 healthcare providers, and then 10 other individuals, including people who were in roles such as data stewardship and database managers. And we had 3 patient partners attend the workshop as well as respond to our survey. When we analyzed, oops, can you go back a slide? Because the results are on the right-hand side. The main gaps that were identified by these respondents included lack of interoperability between systems, lack of data governance structures, lack of access to real-world data, lack of technological infrastructure to analyze big data in real time, and lack of coordination between people who have the data and people with the data science skills. Some of the strengths that were identified include we've got lots of talent in our province in all these areas, and we, I think, have a great opportunity here to bring some of these talented individuals together. Other strengths that were highlighted from several of the respondents were the fact that we've got the infrastructure for something like Pop Data BC and opportunities for longitudinal data because of our healthcare infrastructure system. So each individual has a primary care, personal health record number, and that allows us to have access to where the individuals are receiving care across the province. The opportunity for innovation. So we've got a lot of tech sector stuff happening in BC. It's just there's some really cool companies out there. We could tap into some of that talent as well. And then we've got a new government. So some folks thought that was a great opportunity for moving forward with the current with the new government in place. Our first activity, we asked individuals to jot down several ideas on each idea on a Post-it note. This is an activity called Affinity Mapping, and we asked them, if you had no constraints, what is the audacious goal for data science and patient-oriented research? Our results from that activity were that we have the opportunity for patient-centeredness in the bottom. Patients have control, access to, and knowledge about their data. We would love to have a data ecosystem to the right where integration of person-centered data include health data and non-health data. So, for example, the individual who's accessing both social services and healthcare supports in the province would be important to include. In the center, we would people want technology that informs patient care, and then to the left, integrated technology and analytic infrastructure. So we can have hardware, software, analytic tools that allow us to do natural language processing, machine learning, etc. So these are the, if we didn't have any barriers such as time constraints or budget constraints, these are the vision that we want to achieve. Next slide. The next activity we did was we asked people to tell us what networks need to be developed. we gave a list of goals we had 6 tables with different topics on each of the tables, and we asked each table to draw a figure that would answer the question, what is the network that would be needed to achieve these audacious goals? They, if we go to the next slide, we can show you an example of one of the results. So there was lots of various ideas that were brainstormed in this activity. And in this photo, you can see the topic for this table was called Advanced Analytics and Artificial Intelligence. Some of the people that are identified include, again, I can't quite read it from here, the subject matter experts, patients, caregivers, health professionals, decision makers, the suggestion that we need some sort of a deep learning opportunity for software design, possibly some analytics, a community of people supervising analytics, models that describe hypothesized relationships, some sort of a costing of it. We also had ethics, different funding bodies. So you can see the networks of people that would be required to achieve this advanced analytics and artificial intelligence is almost a map of the entire universe. What we're doing, though, the thing that happened during this activity was that the people who were in attendance kind of got to think about and brainstorm the different stakeholders who might need to be involved. Next slide, thanks. The third activity that we did, we called it To Infinity and Beyond. And we asked people to identify specific project ideas. Next slide, please. We did this through a brainstorming activity, and while this list is looks kind of long and has some overlapping areas, we're yet to kind of settle on the direction we're going to go, and hope to get some input from not only the attendees at this webinar, but others in a couple next steps. We had these ideas brainstormed with those individuals who were in attendance. So, for example, on the left, a precision medicine system to tackle cancer in BC. Not sure we'll be able to answer in BC, but the data science methods cluster will be able to possibly take a portion of this and think about maybe that's one of the target areas. And I'll discuss in just a moment what the next steps will look like. Other suggestions were a project to identify citizens' views on privacy and use of their health data. Another one was apply natural language processing to existing electronic health record or electronic medical record in data in BC to validate methodologies. A couple of people on the right-hand side actually gave us some domain names. We haven't checked whether these exist or not, but healthmatch.org, someone suggested. Some sort of an app where clinicians can identify data science researchers to tackle clinical problems. Another suggestion was wellbeing.bc.ca, some methodology to engage citizens to donate their social media data so that we could use natural language processing to identify issues, for example, things like stress. So you can see the list of ideas here is quite broad and, again, a map of the universe. And as we proceed with our next steps, we will be taking these things into consideration that came out of our brainstorming activity. Next slide. So the next steps will involve an establishment of some sort of guidelines for our project selection. We'll have some sort of a prioritization process. We'll be identifying project leads and collaborators. We will have some sort of an external advisory process to help support the development of projects. We will be creating a workshop report. We're only, like I said, about 6 weeks out from our actual workshop, and once we get some feedback from this webinar as a couple of other activities, we will be summarizing what happened at the workshop as well as this consultation process. And we will then be creating a work plan for the DASHE methods cluster, which will be executed over the next 3 to 4 years. I think that's it. So thank you for your time, and we have lots of time for questions. I also want to note, as you see on the slide, on December 13th, we are going to have a webinar on the overall activities about the BC Support Unit methods clusters. So as Allison noted, we have the Knowledge Translation and Implementation Science methods cluster. In addition to the Data Science and Health Informatics methods cluster, we have the Patient Engagement methods cluster, the Real World Clinical Trials methods cluster, the Health Economics and Simulation Modeling methods cluster, and the Future methods cluster on patient-reported outcomes measurement. So there will be a webinar on December 13th from noon to 1 that will talk about the overarching goal and processes that will happen across these methods clusters. So we can take questions.
Yeah, so you have 2 options for your questions. Please feel free to either ask them by voice, or if you prefer, you're welcome to write them in the chat box. If you prefer not to ask questions at this time, but rather to percolate on them and ask later, you can see our email addresses on this screen. We have been very intentional about making sure that, as Leanne had described, how people got to the visioning workshop, we had an open call where we asked people just to submit an expression of interest and answer some questions. Then at the workshop, we wanted to ensure that we had regional representation and representation from different stakeholder groups, etc. Then for those who couldn't attend, there's this webinar, plus the recording of this webinar, plus you can reach us at any time, plus every 2 weeks on the support unit newsletter, we have a methods cluster corner where we highlight the key messages from the activities of each methods cluster. So I don't see any questions yet, but does anybody want to ask them? Okay, while we're waiting for any questions, I can just give a little bit more detail about the session on December 13th. As you know, we had a very a wonderful, exciting conference for the support unit, our first annual conference, just over a week ago. And we had we had 292 people there, which was fabulous. And one of the sessions was about the methods clusters. And people were particularly interested in 2 questions. First of all, how do they get involved? And second of all, what are the processes that are in place to identify which and how projects move forward? So the focus of that session on the 13th, we've got a draft of the presentation for that almost completed. The focus will be to give people the details about how we've undergone this process for methods clusters. As you may be aware, none of the other support units across the country, BC is unique in its support unit, having methods clusters, which exist solely to address methods questions. So we've developed along the way, because there was no existing template, but we've been guided by the evidence in the literature about how to do these things. We've developed processes to identify and move projects forward that methodologists can work on collaboratively. So for example, as you know, and normally in research, what happens is there's a call from a funding agency who then either has a theme or a topic, a disease or a type of intervention that people can submit, researchers can submit applications for funding. That's then a competitive process, and the best projects are funded, those that meet certain criteria. The difference with the methods clusters is we invite everybody into the room and continue to invite everybody into the room to share ideas about what those projects might be, and then to put up their hands to say, oh, I'd like to lead this project, or I would like to collaborate on this project, or please keep me informed about this project. So then once people within the community say, yeah, I would like to participate in one of those three domains, then collectively, moving forward, there's funding to enable those project leads and those project teams to work on those projects that have been identified collectively by the community as the most important projects to take forward. Are there any additional questions?
It's Rick Sawatsky here. Thanks very much for this introduction. It was very helpful. I just have I guess it's a broad question that I'm struggling with a whole e-health world. What are the criteria, I suppose, by which you determine whether these technologies are in fact patient or person-oriented, and has there been work done, being able to classify these technologies and approaches as being patient-oriented or not, or something in between? And the reason I bring it up is I've been to quite a few of these meetings and conferences now, and I'm just that are like patient-centered, or patient experience-oriented. But it always surprises me how much of the agenda is driven by industry, by healthcare providers, and of course that SPOR is trying to address exactly that concern. But I imagine it's particularly challenging in the realm of e-health. And so how do we actually get people at the center of driving innovation in this area is, in my mind, still a very big question. I don't expect a final answer on it, but
yeah, no, thank you. It's such a great question, Rick. I really appreciate it, and it is definitely a source of tension, I think, in the field. I think I particularly like the way that the support unit is taking up what is patient-oriented research. So engaging patients as partners, focusing on patient-identified priorities, partnership with relevant stakeholders, aims to apply the knowledge generated to improve healthcare systems and practices. So we, as we're kind of figuring out what our criteria will look like, or the characteristics of the projects, we're definitely taking into consideration that it will have any of the projects that we fund as we move forward will be will have an aspect of making sure that it's patient-oriented and it's not just technology for technology's sake. Unfortunately, in things like statistics, there might be a few steps away from a patient in regards to helping inform the specific methodology, but I think we can very easily, if we put the patient at the forefront and the patient partners involved, we can very easily explain what is the thing that's the most important to the patient as to help guide where we put our efforts. I know that's kind of a non-answer and a generic answer, but I think it's going to really help us not just do technology for technology's sake.
Yeah, thanks for that. And I wasn't expecting a final answer. I realized it was a big question, but actually more intending to affirm the work of SPOR in this area. Thank you.
Are there any additional questions? Thank you, Rick. That was an excellent question, and it's one that is relevant, maybe in this case, not just to this methods cluster, yes, as far as e-health, but also that question about ensuring that it's truly patient-oriented research. I can assure you that at the support unit, each and every person that is involved in the support unit, we eat, live, and breathe this to our core. Any additional questions, either by voice or by chat?
Hi, gang. It's Kent here, and I was sitting here with my hand up electronically for a bit, but I guess I wasn't being seen. My question follows up a bit on what Rick was just saying. He was talking more specifically about patient-identified priorities, and you know, Leanne and I are certainly known quantities to each other, but for the others on the webinar who are not us, I thought it might be a good opportunity to talk about some of your thoughts, Leanne, about opportunities for patient engagement in the work of the methods cluster more broadly.
Yes, and so we definitely are going to be reaching out to the advisory council as we move forward with the topic areas that are identified as priority. And we had some conversations about how to engage our patient partners in even the synthesis of these results. And I know you and I have talked a little bit about those possibilities, and I think it would be a great opportunity to have a cadre of individuals who are interested in learning a little bit more about data science and health informatics. So not coming to the table with the skill set, but who have an opportunity and interest in it to help us along the way as we're gradually evolving what the topic areas that we're addressing. And I think that the other methods cluster leads have also been thinking about, you know, what is the best way to engage our patient partners without you needing to get a PhD in the topic area, but where, especially if there's an interest in the topic area, to have some learnings happen.
Thank you, Leanne. And if I might add to that, I can you know, piggyback by saying, yes, all the cluster leads are, there is an intentional desire for appropriate and meaningful engagement in the cluster activities. And what that means is, well, first of all, the learnings are both ways. that it's not just about the patients having to be subject matter experts in the area, but also bringing their experiences not only as patients, but also in their realms, their occupations, that they can share with the cluster, and particularly the involvement of the clusters is driven by projects. So whether you're a patient, whether you're a healthcare provider, or whether you're a researcher or a decision maker, and that even goes for our Ministry of Health representatives, the idea is that as the projects are moving forward, that people say, hey, I have a passion for that particular topic. I don't have to be a data scientist to really value this particular project, and in the way that's most relevant for me, I would like to contribute to that team. So I ask you to keep availing yourself of the Methods Cluster Corner on our newsletter, where we share every 2 weeks where we are with each cluster. And as you see those projects being identified, being refined, at any time, you can reach out to us and say, wow, that looks interesting. How can I be involved?
Great. Thank you for the question, Kent. Anybody else?
Time maybe for one more question? Okay, if not, which is fine, because we're all looking for minutes in our day that are gift minutes in our heavily scheduled days. So I would like to thank you all for participating in real time, and those of you who will be reviewing the recording of this. Leanne, thank you for the excellent overview. Whether we were at the Visioning workshop or not able to be there, I found, even though I was there, I found this review particularly helpful for me in consolidating everything and really hitting the high messages from the day. So thank you all for your time, and we look forward to ongoing communication with you all. Thank you.
Yeah, keep in touch.
Thanks, everyone.
Thank you. Bye.
Thank you.